Now, when it comes to adults, many of us take steps to prevent something from going wrong with our eyes.
Yeah, as often as we can, and that may involve eye drops. Well, maybe you use them on a daily basis. Maybe you use them once in a while. Probably you would agree it's not always the easiest thing to do, right? Oftentimes too much comes out of the bottle or you miss your eye altogether. That may make you think about not using the drops at all. As Brian Spiros points out, that's not a good idea.
Eye drops may not be the easiest medication to take, but they are just as important as anything you put in your body to stay healthy.
People think that eye drops are not counted as medicines, but they are medicines. They are absorbed into the body, and they have side effects like any other medication.
Dr. Catherine Smoot-Hasselness is an ophthalmologist with Chesapeake Eye Center. We stopped by their Salisbury office to talk about what everyone should know, whether you use eye drops all the time or once in a while. Dr. Smoot says many people underestimate the impact these tiny bottles can have.
It's not just your eye, your body. These drops are absorbed through your eye, but they can translate to side effects throughout your body.
Every medication can have side effects. Eye drops are no different. That's why Dr. Smoot says it's so important for people to include their eye drops when giving a list of medications they're on to their primary care physician.
So I'll see people who come in this office and they will have been through a CAT scan and all kinds of workup for a specific problem, seeing specialists for this and that. When I take one look, it's your eye drop. You stop the eye drop and the problem goes away. And if they had shared that with their doc, whether it be their ophthalmologist or the primary care doc, shared that information right up front, it could have saved thousands of dollars in healthcare costs and workup.
Dr. Smoot adds that everyone should be using their eye drops exactly as prescribed, because using it too much or too little could impact whatever it is you're trying to treat.
Eye drops, like any other medicines, are designed for specific use, specific dosing to get the appropriate effect for treatment of the condition.
Eye drops have many uses. They can treat anything from dry eye to glaucoma, even infection. Did you know the bottle tops are color-coded for a reason? They indicate what type of medication it is. For example, Dr. Smoot explained that tan is usually an antibiotic, while clear or white usually means over-the-counter.
Many times people are on more than one medication, more than one eye drop. And so the color coding helps them understand and remember what they're taking.
And speaking of using eye drops, putting them in our eyes can sometimes be a challenge. Dr. Smoot has some simple tips that will help make it easier. First, you squeeze the bottle and too many drops come out. It's happened to all of us, but there's a way to control that.
The tip to taking your eye drop is to gently hold the sides. If I squeeze the sides, it comes flying out. If I hold it gently by the side and push the bottom of the bottle, one drop. That's how you control the dosage delivery in your eye drops.
So there's another method. If you need someone to put the drops in for you, there's a little trick, and you're going to show me.
Sure. Just have your partner or your spouse pull down your eyelid, say look up at the ceiling, and come in from the bottom. I can push the bottom. If you come in from the top, see how he blinks? Come in from the bottom and just gently put it in.
All right, so there's a third tip, and this is for people who are unable to put the drops in themselves, an older person, and they don't have anyone to help them, and it involves these glasses.
Absolutely. Trick. Get a cheap pair of little sunglasses or just play glasses that are plastic lenses. Mark where the pupils are. Have a hole drilled from the inside out. Then all you do is put the glasses on, the tip of the bottle, let Brian demonstrate here.
And put my head back.
Put your head back. Put the tip of the bottle into that hole. It'll line up with your eye. Push the bottom of the bottle, and that drop should go right in there.
It went right in.
It's perfect.
How simple.
The red's a great look on you.
Very simple, isn't it?
And that's a cheap fix for an individual who doesn't have assistance in the household and wants to maintain their independence and compliance.
And they can't hurt themselves.
And they can't hurt themselves this way.
Finally, if you do happen to miss a day, Dr. Smoot says don't try and play catch up.
If you miss it, you missed it. Move forward. Don't do multiple dosing because, again, that increases the risk of those side effects.
Some great tips. Who'd have thought? And I love those glasses. Now, here are some other important tips that you do need to keep in mind. Dr. Smoot says use your eye drops as often and for as long as they've been prescribed. Just because you're feeling better does not mean that your issue is resolved. Even if you take your eye drops correctly, you may have some extra liquid left in the bottle. Dr. Smoot says it's not a good idea to use them later. Those drops could be expired or harbor bacteria. And finally, as a friendly reminder, Dr. Smoot says place your drops near your toothbrush so you'll remember to take them every day, every morning, every night, whatever the case may be. Now, to read more from Chesapeake Eye Center about eye health, all you have to do is go to DelmarvaLife.com and click on the Show tab.